So you guys might be wondering what is leukemia, right? So basically, leukemia is a cancer of blood-forming tissue, including bone marrow and our lymphatic system. So these blood cells are not fully developed and are called blasts or leukemia cells. It will lead to a production of abnormal white blood cells in our body that impair our body's ability to fight infections and produce normal blood cells.
Now I would like to share with you the type of leukemia. The first one is acute lymphocytic leukemia, acute myelogenous leukemia, chronic myelogenous leukemia, and chronic lymphocytic leukemia. So these four types have a different symptom because it occur with these different factors. Background study of leukemia in Malaysia.
Leukemia is a significant health concern in Malaysia. According to the Malaysian National Cancer Registry report, it is the seventh most common cancer in the country. Among children, acute lymphoblastic leukemia is the most prevalent and account for a large proportion of pediatric cancer cases. In adults, acute myeloid leukemia and chronic myeloid leukemia are more commonly diagnosed.
Good evening, everyone. Leukemia in Malaysia. According to the latest World Health Organization (WHO) published in 2020, leukemia deaths in Malaysia reached 1,412 or 0.84% of total deaths. The age-adjusted death rate is 4.58 per 100,000 of population, ranking Malaysia to the 38th in the world. I'm Ricardo reporting.
Today is so boring.
Yeah, today is quite boring, right?
How about this? What do you guys think?
Yes, that sounds so good.
Okay, let's play.
Let's decide who will be the trouble first.
Whoa! Come on!
Go, Adik, go.
Oh, I miss it.
Yes!
Here, I keep ready. You go arrange the zipper.
Okay, sure.
Wait.
Wait, what's wrong? Mahir.
I don't know. I feel really tired.
Huh? Tired? What do you mean? We just play about a minute.
I feel like...
Oh my god! Adib! Kau ada bila ni?
Huh? What happened? Okay, wait. Let me call the ambulance.
Mahir Hauzan.
Yes, doctor.
So, what are you feeling right now?
I I feel better now from the last medical checkup.
Yes, I got it. Okay. So, from my research that I got, I think you might have leukemia.
What? Leukemia?
Yes, leukemia. You know what is leukemia?
No.
So, let me give you some definition about leukemia. So, as you can see in this picture, this is the difference of normal blood and leukemia. So, the difference is, for leukemia, they have many white blood cells in their blood, not like normal blood. Understand?
Yes.
Okay.
So, what is this leukemia actually?
So actually, leukemia is one type of cancer that give abnormal blood forming. So from our analysis, you are in the stage 2 cancer of this type. So, but don't worry, our team will give you the best commitment and cure your disease.
What? Cancer, doctor? No. I don't believe your words. In my generation, never have cancer. I don't believe your words. I not get a cancer. I don't want to go from here. I don't believe you.
Wait, sir, calm down. Please take a seat back. Let me first explain you about the symptoms of the leukemia.
Okay, I will take my seat back and hear your words.
So, let me explain about the symptoms. So, the first, you might have pale skin. Second, you might have shortness of breath. Third, you might easily get tired. Fourth, you will have unexpected lost weight. Fifth, you will feel joint pain easily. So, and finally, you might have fever.
What the problem with this question? This question is so hard. I'm tired with this. I want to take a nap.
Leukemia.
Why is this still my dreams? You didn't even my notes. I don't study it. So let's talk about causes of leukemia. First is genetic mutations. Leukemia occurs when mutation in bone marrow cells cause them to grow uncontrollably and disrupting normal blood cells production. Then exposure to the radiations, like high level of radiation such as from nuclear accidents, increase the risk of leukemia. Next is genetic and hereditary factors, like people with genetic disorders like Down syndrome have a higher risk of leukemia due to inherited DNA abnormalities.
Next is lifestyle factors like smoking. Smoking introduces cancer-causing chemicals into the body that can lead to the leukemia. Next is human with weakened immune system, like individuals with a weakened immune system, like having HIV or AIDS, are more vulnerable to the developing of leukemia. So that is the causes of leukemia.
So, what are the precautions of this disease? There are two types of precautions, which is practical and consistency. So, for practicals, you have to maintain a good diet, such as by eating vegetables, fruits, and other healthy foods to support your overall health. Next, you have to engage with regular exercise, at least exercise 3 times a week to maintain your health, and don't forget to drink water to stay hydrated. For consistency, first of all, you have to practice a good hygiene, like frequent hand washing to reduce the risk of infection. Following by that, avoid crowded place and don't forget your vaccination as advised by your doctor.
So there are several treatments for leukemia. First one, we have chemotherapy. Chemotherapy is the most common treatment for leukemia. It uses strong chemical to destroy leukemia cell and stop them from multiplying. Next, we have immunotherapy. It uses certain drug to boost immune system to fight leukemia. Third one, we have bone marrow transplant. It replaces damaged bone marrow with healthy cell. This healthy cell now multiplying to form new bone marrow and blood cell. Lastly, we have chimeric antigen receptor T-cell therapy. It involves taking the patient on T-cell, modifying them to target leukemia and reinfusing them into the body to fight cancer more effectively.
You are already discovered that there are a lot of treatments for leukemia. But in Malaysia, there are two common treatments that used among the hospital to treat the leukemia patients. First, we go with chemotherapy. Chemotherapy is a treatment that uses a drug that travels through the bloodstream to kill the fast-growing cell like cancer cell.
So, the other common treatment in Malaysia is bone marrow transplant. Bone marrow transplant is a special treatment for patients with certain diseases or cancers. So, basically, bone marrow transplant is a process where damaged or destroyed stem cells during your cancer treatment will be replaced with a healthy one. First of all, the stem cells will be collected from you or the other donor. Then, the stem cells will be stored while you receive your cancer treatment, such as radiation or chemotherapy. And finally, when the treatment are fully complete, the healthy stem cells will be given back to you. So these healthy stem cells provide healthy supply of future blood.
But you won't see me break. Call you up in 3 days, or send you a bouquet, saying it's a mistake. Drink my troubles away, 1 more glass of champagne, and you know I'm the first to say that I'm not perfect, and you're the first to say you want the best thing. But now I know a perfect way to let you